CDC is reviewing data on PFAS chemicals in fish samples taken from 3 major rivers in Maine after a national study found levels in freshwater fish are much higher than in commercial fish.
Studies have linked exposure to man-made chemicals to an increased risk of kidney and testicular cancer, complications during pregnancy, and thyroid problems. 8 waterways are currently flagged with fish consumption advisories for PFAS right now. Regulators are now looking at the possibility of adding more to the list.
News Center Maine's Vivian Lee has more in this report.
Maine's thousands of miles of rivers and streams and hundreds of freshwater lakes are home to a variety of fish. But scientists say just eating one freshwater fish annually could spike toxic chemicals in your bloodstream.
Even consuming any of these freshwater fish infrequently, once a year even, would likely lead to a significant increase in blood serum levels, so our exposure for the year.
David Andrews is a senior scientist at the Environmental Working Group. EWG analyzed environmental protection data on PFAS chemicals in more than 500 fish samples from rivers and lakes across the U.S. and Maine, taken between 2013 and 2015. The EPA has set advisory levels of PFAS in drinking water to just 0.2 parts per trillion, but 8,000 parts per trillion was common in the analyzed freshwater fish. This interactive map shows the data coming from a half a dozen rivers from the Saco to the Machias River, plus a breakdown of the chemicals. The highest was PFOS, one of the thousands of forms of the compounds.
That was a primary ingredient in Scotchgard. It was also used in a lot of textile coatings, and it was also an ingredient used in firefighting foam.
The highest levels of PFOS were found in smallmouth bass, taken from 2 areas of the Kennebec River between Waterville and Augusta. Lower levels of the chemicals were detected in fish in the Androscoggin River in Lisbon and in the East Branch of the Penobscot River. Lindsay Hams, the communications director for the Maine Center for Disease Control and Prevention, tells the News Center none of the waterways named in the study warrant a fish consumption advisory based on the 2014 data. But, she said in a statement, Maine CDC is reviewing new data on PFOS in fish from the Kennebec and Androscoggin rivers and will evaluate the need for a fish consumption advisory in consultation with Maine's Department of Inland Fisheries and Wildlife and the Department of Environmental Protection. In the meantime, Maine CDC is recommending that anglers and fishermen make themselves aware of the existing fish consumption advisories. Dr. Rachel Criswell is a family practitioner at Reddington Fairview General Hospital. She monitors patients who have high levels of chemicals in their systems.
We really are dependent on fishing and hunting for food and for recreation, and so I try to encourage people to continue to enjoy that, but keep an eye out for those warnings.
Vivian Lee, News Center, Maine.